Hello and welcome. I am Barrett Longcar, owner of Body Mechanics Orthopedic Massage here in New York City. One of the questions that we get asked a lot is, can I talk to my massage therapist before the session? And the answer is a resounding yes. But that consultation is built into the beginning of your massage appointment. What follows is an example of some of the questions that your massage therapist might ask when you book your appointment. It's really important to understand that your consultation might be a little longer or a little shorter than this example. It also might include some physical assessment as well as some movement so that we know that we're on the right track when building our treatment for you. We hope that this video answers some of your questions. All right, so thank you for coming in. I'm going to be your therapist today. I was hoping that you could give me a little bit of an idea of what brought you in today.
Okay, so my neck has been hurting.
Oh, I'm so sorry to hear that. How long has that been going on for?
It started, I think it's been years ago, but it got worse I don't know, maybe 2 months ago.
Oh, interesting. That sounds like a really long time. Is it go up and down, or is there any kind of pattern that you can find to it?
I can't really figure it out, and it's starting to worry me a little bit.
Okay. I mean, that is natural to be worried about your pain. Can you tell me a little bit about the time period where it got worse? Was anything going on in your life, or was there an event that precipitated that?
Yeah, it happened. I noticed it a few days after I was working out, but I work out a lot, so I wasn't really sure if that was it or I don't know, did I sleep funny? And in the past, I had noticed some stuff and I didn't really know because in the past it's also gone I felt like there was something pulling in my chest and I didn't know if that was something but that went away, and now this neck thing's been going on and I don't know, is this a chest, my chest too tight? Is that is it?
It can be really hard to figure out. That's actually the purpose of this interview. So we're off to a really good start. Let me just dial it back a few steps. You keep touching your neck. When you're doing that, or your chest, when you're doing that, is that the area of the pain, or is it primarily more neck, or is it shoulder?
I mean, I guess it hurts the most over here.
So more in the sort of back posterior area. Okay, perfect. And then when it got bad, what was the pain level, would you say, when the pain changed for you?
It was pretty sharp.
Oh, interesting. Okay, so, and are there any other feelings that go with that?
What do you mean?
Would you describe it as you mentioned before, there was a pulling sensation?
Yeah.
So if there are words that you could use to describe the kind of pain you're having, for me, it can be very helpful for me to understand then what's happening in your body.
So I didn't feel the chest thing this time, but this time it was definitely sharp. It didn't really feel I guess it felt tight too, but the tightness was more I guess lower.
Lower. Okay. And would you describe the onset as a sudden onset, or did it kind of come in slowly and creep in?
I noticed that my back was getting tight for maybe a week or so before it happened, but then just sort of out of the blue after I woke up one day, it was there.
Okay. And does the pain travel at all?
What do you mean?
Does it? So you said that you primarily, it's in the back of the neck, sort of in this area in the front.
Yeah.
Does it ever move around to other places? Does it go down the arm or up into the head?
No.
Okay, that's good news. Sometimes when we see pain traveling, it can mean that there's some more complications happening, but it doesn't sound like you have any of those today. So I'm happy to hear that. When we're talking about the pain, it started out at one place and it went to another place. When it first started, what would you say that was on a scale of 1 to 10? 10 being the highest.
I'd say maybe a 5.
Okay. And then when it got worse, what was that?
I think maybe at its worst, maybe a 7.
Okay. And where are you today?
It is starting to get a little bit better. So I would say a 4.
Oh, excellent. That's great. On that note of getting a little bit better, I want to ask you some questions about behavioral things. Are there things that you're doing that are working to make it a little bit better for yourself?
Yeah, so sometimes I'll take a ball and I'll just kind of go against the wall and I'll kind of push on some of those areas in my
Okay.
back, like especially before I work out, I foam roll
Mhm.
and that seems to help, but it only lasts for like, I don't know, like a few hours. So I
Okay.
was hoping that like if somebody who really knew what they were doing could get in there, they could like dig out whatever's going on there.
Possibly. And I'm glad to hear that you have some ability to control it a little bit. Having small things you can do throughout your day to make yourself feel better when you're having pain can be really helpful in decreasing your anxiety. And it's a really good step towards making good choices for yourself. I'm glad to hear that massage is working for you. On that, have you ever had massage before?
Yeah.
And when you have it, what kind of massage do you typically like?
I like pretty deep pressure.
Pretty deep pressure. Okay. We will take that into consideration today. We'll be choosing the pressure that's most appropriate for you, and I'll be encouraging you to give me some feedback about what it feels like to
Okay.
you in the session, so that we can
That
kind
sounds
of
good.
walk the
Yeah.
balance between what is good and what will work for you.
Yeah. Yeah.
Is there anything that you have been doing that makes it worse?
I'm not really sure. I sometimes think because it's really just on this side, I sometimes wonder like, am I doing something in my sleep that's aggravating it?
Are you sleeping well?
I sleep okay.
Okay, that's fine. It is possible to irritate things when you sleep. Obviously, you wouldn't know about it, but as long as you're moving and getting good sleep, that's really important to your pain as well. Is there anything else that you can tell me that might relate to this in any way? Sometimes knowing what types of exercises that you're doing can be helpful to knowing what sets it off and what makes it better.
I mean, the only thing I do wonder also because I wear a cross body bag. Most
Mhm.
of the time, I put the strap on this shoulder, and I
Okay.
do want. I'm not sure. Like, is that like would it help to put it on this
Have you
one?
tried?
No.
Okay, it's something to try. We won't really know until you
Yeah.
do, but modification of behavior is also a really good way to help try to solve problems. And even if it doesn't solve the problem, it can inform us and you can learn a little bit about what might be causing it, even if it doesn't change. Anything else?
No, not really.
All right. So, am I correct in assuming today that your primary goal is pain reduction?
Yeah, yeah. I really want to take care of whatever that neck thing is.
Okay. And are you having any range of motion problems along with that?
I don't know. I don't think so.
Okay, well, we can do a quick physical assessment after this to sort of confirm that and let you know what's going on there. So I just want to just sort of summarize what you're saying to me. Right now, you're coming in for a massage that is primarily focused about reduction in pain because you had an event a little while ago that sort of triggered a increase in pain, but it's recently gone down. And your primary focus is sort of this neck, chest, back of neck area. Is that right?
Yeah.
Okay, perfect. So the next step is going to be that I'm just going to discuss with you your treatment options. Is that okay?
Yeah.